Welcome to Season 2 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. In this bonus episode, I speak to Dr. Tom Inglesby, Director of the Johns Hopkins Center for Health Security, about the White House outbreak of COVID-19. Our topics include the origins of the outbreak, what likely happened at the Saturday reception, and what's necessary to get the outbreak under control. We also discuss whether future presidential debates should be moved online, whether the vice president needs to self-quarantine, and the threat right now of a major outbreak of COVID-19 that cuts across the corridors of power in Washington, D.C. Our conversation was recorded in the evening of Sunday, October 3rd. Let's listen. Dr. Inglesby, thank you so much for joining me for an extra episode of the Public Health on Call podcast, given the extraordinary White House outbreak of coronavirus. Before we get started, I just want to say that I think both of us hope the president and the other people who are sick with coronavirus get better very quickly. It may be a few more days before we really know that the president has recovered. Would you agree?
Yeah, at this point, I think it's a lot of reassuring things coming out of the medical team from the White House, but still some uncertainty. So I think it's going to take us some days before we know for sure what direction it's going to go.
I don't want to ask you too much about the specific medical situation of the president, but I do want to ask you about this outbreak. When would you say that the story starts?
Well, one way to think about the story starting is just the way that the White House has been approaching large gatherings for quite some time. I think I've been really worried about the events that have been on White House grounds, the rallies that have been happening, where people are really closely spaced, not wearing masks. They're around each other for prolonged periods of time. And this is really not what we should be doing in a pandemic. It's kind of directly against what CDC is advising. And I know that the White House has said that they've been doing very stringent testing to try to, make sure everyone stays safe. But it just shows the limits of that approach. Testing is great, but testing is imperfect, especially the rapid testing. And sometimes cases will get through. And when they do, and you have a large gathering where people are really sitting close together for periods of time and then mingling indoors after the outdoor sessions, it's a setup for a super spreading event. And so I think the conditions have been ripe for a while, unfortunately, but they really seem to have come to a head this past week.
And so Saturday, everybody gets together because of the nomination of someone for the Supreme Court, Amy Coney Barrett. And there is an outdoor ceremony, but also an indoor reception.
Right. And you can see from many of the photos that have been published from that event that unfortunately a number of very senior officials who were in attendance at that event in the first row, the second row, or near the front of the Rose Garden ceremony have now tested positive for COVID. And whether they got it when they were sitting in the front row or whether they got it when they were in the reception afterwards, and there are photos of that reception, the indoor reception where people are standing close together without masks, mingling, unknown. But certainly the number of people from that reception who've now become positive this week is striking. While we're not, you and I aren't directly involved with the contact tracing operation, I think from the outside, it's fair to say that it looks very likely that event was part of this big White House outbreak that's unfolding.
Now, have you been in the White House, inside the White House, in those rooms where those receptions are? I mean,
yeah.
How do you assess those rooms in terms of the potential that they could be a source of super spreader event?
Yeah, I mean, they're lovely rooms, big rooms, but they're not cavernous. They're not an auditorium. They're like a nice ballroom type, small ballroom type size of space. It's an older building. I suspect that the ventilation is, kind of like other buildings in some ways. When you're near people, you are going to be exposed to their respiratory droplets, even if there are particularly good filters in the ceiling or ventilation. So I think it's like other indoor events might be, in the sense that if there are a lot of people gathered together and they're not wearing masks and they're together for some time, that's the ideal situation for someone to infect many other people, or someone's to infect many other people, unfortunately. And it looks like that happened.
So you have the White House disregarding advice on mask wearing and social distancing, and then having an event not only outdoors, but also indoors, where people are standing very close together. And now multiple people from that event on Saturday have been diagnosed with COVID, including the President of the United States, the First Lady, and others. How long will it take for all the people who got infected at that event to show symptoms?
So the incubation period for this disease is somewhere in the order of 2 to 14 days. And we think that most of the people probably will be infected in the first week, if they are going to get infected. But there is a tail, so that it is possible for people to continue to show signs of infection or to develop a positive test in the second week. So we won't know until another week from now, or 6 days from now, really, whether people coming from that particular event who got infected could still be infected from the primary event. And for the people who have now developed a positive test, until they were isolated after their positive test, they were still potentially infectious, and anyone exposed to them in that time period would be at risk for the 2 weeks to follow.
Before we get to them, though, I just want to still focus on that Saturday event. Let's say I went to that Saturday event. I mingled. We don't know yet who was the person who was the source.
No, we don't.
So what would you advise me if I had gone to that event and I'm not sick yet and it's only about a week afterwards?
Well, if I were at that event, particularly if I were in the indoor event, but even the outdoor event at this point, given the number of people who were walking around who became positive, tested positive, I would self-quarantine and I would get tested. And I think in the end, contact tracers will go back through this as best they can from the public health department of jurisdiction, and they'll try to identify people who were, spent the most time with positive cases or spent at least 15 minutes within 6 feet. But given the very high number of people who really are already diagnosed, it seems to me that if you were at that event, you should presume that you're at very high risk and make sure to get tested. And you should basically take the 2 weeks. It's already been more than a week. It's been 8 days, but I would finish 2 weeks of quarantine at home.
Now, I think that may apply to the vice president. Was he at that event?
Yes. So the vice president was in the front row of that event. So I think, he would be at high risk given the people that were, if you look at the photo, there was someone Senator Lee sitting directly behind him, became positive this week. Kellyanne Conway sitting catty corner from him became positive. The First Lady was directly across the aisle from him, became positive. So I think he should consider himself exposed from that event. But even if he hadn't been at that event, it was reported in the press that he met with the president on Tuesday in the White House. And we know that people are contagious with this disease for up to 2 or even 3 days before they show symptoms. The president showed symptoms on Thursday, we're told. And so given that the vice president met with him on Tuesday, 2 days before, he should be considered a contact and should quarantine for 2 weeks.
So he has 2 sources of exposure. He could have been exposed along with the president on Saturday. And then he also could have been exposed by the president on Tuesday.
Sure, or other people working at the White House at this point. I mean, I think it's very unclear who at the White House is infected at this point. We heard that the president's personal aide, we heard today that he was infected. We've seen a number of other people over the course of the last couple of days test positive, Hope Hicks, others. So I think it's pretty unclear at this point who is testing positive. It's clearly an outbreak in that community. And given all the uncertainties and the stakes for potentially infecting others, I think people should really, if they've been in that environment, if they've been interacting with that community, they should quarantine for 2 weeks and get tested.
And if their test is negative, they should still quarantine?
Yeah, that's what the CDC guidance is. And the reason for that is because you can become positive over the course of time. Even if you're negative on day 2 or 3, you can become positive later. So the CDC guidance is to get tested and to stay in quarantine. Hopefully you stay negative, but you don't know.
So with multiple potential sources of exposure, the vice president falls squarely into that. He's supposed to participate in a debate this week.
That's right. Yeah, the debate's coming up this Wednesday, which will be about 10 days after the Rose Garden ceremony and about 8 days after his reported meeting with the president. And so my view is that this debate should be done virtually. I think at this point we've seen a number of things. Not only is the vice president potentially exposed, hopefully won't get sick, but potentially exposed. But in addition to that, we saw that a number of workers in Cleveland who were preparing for the debate have gotten sick with COVID. And that was attributed to their work related to the debate. And we also saw that during the debate, a number of the Trump family members decided not to wear masks, even though that was required by both the Cleveland Clinic and the Presidential Commission on Debates. So that was against the rules and increased the risk within the audience and within the room. So given that as an additional factor and the possibility that that could happen again, I think at this point we should move the debates to a virtual format. It can be done extremely well and very proficiently on video link and by whatever means. And that way, minimize the travel, minimize the exposures of people, and still be able to hear the views of the candidates.
Got it. So that's one major implication of the outbreak. Other implications are that a lot of people should be quarantining. And there are people who were at that event on Saturday who, as you point out, could still be in the window for infection. There are people who were with the president at multiple events last week in Minnesota, in New Jersey, who are now being contacted. And if they were in close contact with the president, they should be quarantining. Is that fair to say?
Yeah, that is fair to say. I mean, we haven't heard the details of the outbreak investigation, but I know the governor of New Jersey has said that their team believes that if you were at the New Jersey event with the president, that you should be quarantined, and they're all being communicated with by the public health agencies there. So
we have a number of infections, but this is probably not the end of it. Would you say, looking at this outbreak, given that we could still have infections from the very first moment on Saturday still happening, and yet there are multiple other exposures along the way?
Unfortunately, that's absolutely the case. We don't really know who brought the infection into that White House event or other events that may have been relevant to this. It may have been multiple exposures, not just one event, but other events along the way. So there are all the original, exposures and infections, but then before people knew they were infected and had positive tests, they also could have gone on to infect others. So we don't know the size of this, but it seems like it has the potential of being a very substantial outbreak. We'll see. Hopefully it won't be, but it definitely needs very, very serious outbreak investigation by really capable public health experts and a very serious team that can get to the people who are exposed and communicate with them and make sure they understand what's at stake.
This all started with disregarding the advice on how to protect against coronavirus and meetings and events without masks, without social distancing. If the White House were to be an exemplar of a workplace with an outbreak, what would it be doing now? In other words, what would be the approach to this situation so that it is not disregarding how to respond to an outbreak, but actually showing the nation, what needs to happen? What would you advise?
So I think the first thing is, if anyone was in any of those events where there were infected people, they should all be getting tested. That's the first thing. I presume that's happening. The second thing is that if they were in those events or in contact with the people who were known to be positive, they should quarantine for 2 weeks. That's very straightforward CDC guidance. That's what everyone else around the country should be doing, and it's what the White House should be doing. If people in the White House operation can telecommute, and I think some of them certainly can, then they should be doing that. Just as Americans who can telecommute to reduce the density in the workplace, reduce the likelihood of people coming in contact with each other, they should definitely do that. They should also curtail for the indefinite future large gatherings. I mean, a large gathering was likely a place where this disease really took off. Maybe multiple large gatherings. And at this point, I think people should step back and say, that's no longer the right approach. We need to kind of put a lid on, stop these large gatherings. We can do things virtually for the time being. We hope that in the later fall, the winter time, that we'll have perhaps new therapies, but even more importantly, perhaps a vaccine that arrives in the wintertime that's safe and effective. And things will begin to get better in the country at that point. But in the meantime, we're in the middle of a very serious pandemic, and most of the country is still susceptible to it. So I think the White House should be communicating that message and asking people to continue to be responsible, to basically do what they can on an individual level to try and prevent transmission. That's what I hope will be done in the days ahead.
Great. I really appreciate your taking time. I'm going to ask you one last question, though, and it's a what if question, which is, what if that doesn't happen? What if the White House doesn't insist that people quarantine? What if the vice president says he's not going to do it, the attorney general, others, and we just get a picture of an outbreak that just continues to smolder without the opportunity of learning that, as you pointed out, is very much there? And what if they continue to have large events, et cetera, et cetera?
So, first of all, that would be, I think, a terrible message for the country. It basically is kind of disregarding kind of basic, straightforward scientific principles that are observed around the world. So I really hope it doesn't happen. But if it does, I think it basically increases the chance that this virus will continue to really rip through official Washington. I think, the fact that multiple senators were at this Rose Garden event and then went on to have committee meetings later on in the week. One senator was at the Judiciary Committee meeting already feeling unwell with many other senators, some of whom are of an age that is at quite high risk. I think if they don't get a control of this, then there's a chance that this will continue to affect, some of the most influential, important elected leaders in the country and all of their teams. And that has the potential to really affect the government. And I think it's really important to kind of step back and put protective measures in place and try to get control of this epidemic, and through all the means that we use for every other outbreak investigation in the country when these things happen. So that's what I hope happens.
Great. Thanks so much for joining me on Late Notice.
Good talking to you, Josh.
Public Health On Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Lamari Morales. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.